Seniors, beware. 9. Popular medications that can trigger rapid dementia. It's a sobering truth that as you engage with this critical information, approximately 20 seniors globally will receive a devastating dementia diagnosis, a statistic equating to one new diagnosis every 66 seconds. Yet, what truly demands our attention and concern is the terrifying prospect that the fundamental cause of this widespread cognitive decline might not be the inevitable march of aging, but rather something more insidious, lurking unsuspected within your own medicine cabinet. For years, you've been assured these prescribed pills are safe, routine, even necessary for health. However, groundbreaking new research is raising serious red flags, revealing a disturbing truth. 99% of seniors remain oblivious that at least one medication they take daily could be stealthily shrinking critical memory centers in their brain by 28% or more, all within less than 12 months. This reality demands profound reflection. As Dr. Michael Kent, I understand this sounds alarming, but I've witnessed this tragic narrative unfold too frequently in my clinical practice. Individuals place complete trust in their medications, assuming if a doctor prescribed it, it must be harmless. Concurrently, the pharmaceutical industry, armed with decades of knowledge concerning these devastating cognitive effects, continues to accrue billions from selling these very drugs, which may be actively accelerating cognitive decline in millions of seniors. Indeed, a 2023 study published in Neurology and Aging Research made a startling discovery. One specific class of medications increased dementia risk by 49% in seniors within just 2 years of regular use, nearly half again the normal risk. Throughout this comprehensive discussion, I will unveil the 9 most perilous medications implicated in triggering rapid memory loss and accelerating dementia, ranked from commonly overlooked to absolutely mind-destroying. I will highlight number 3 on this list, prescribed to millions for what seems benign, yet possessing the capacity to shrink vital memory centers in your brain, often without you realizing its impact right now. Before we delve into this crucial information, I am eager to hear from you. Please share in the comments section below which medications you are taking daily, and whether you've experienced sudden brain fog or unexplained forgetfulness after starting a new prescription. We are reading every comment and replying with personalized insights. It is imperative that you do not remain silent. Speaking up now could genuinely save your cognitive abilities. Now, without further delay, let us commence our exploration, beginning with number 9. Do not let its position fool you. This medication is likely nestled within almost every senior's medicine cabinet, and it possesses the capacity to begin scrambling your brain's functions long before you perceive the first symptom. Number 9 on our list is diphenhydramine, predominantly sold under the familiar brand name Benadryl. This ubiquitous pink pill has garnered the trust of millions for sleep, seasonal allergies, or cold symptoms. It's inexpensive, readily available over the counter, and likely in your nightstand or bathroom cabinet. You might believe you're simply taking it to sleep better or for allergy relief, yet within your brain, Benadryl is actively disrupting your hippocampus, the specific region responsible for forming and storing new memories. Benadryl belongs to anticholinergics, which block acetylcholine, the vital chemical messenger essential for creating new memories and maintaining alertness. As your brain ages, it becomes progressively more reliant on every available molecule of acetylcholine it can produce. When medications like Benadryl aggressively interfere, the results for cognitive integrity can be devastating. A 2023 study published in the Journal of Geriatric Cognitive Health demonstrated that seniors who regularly utilized anticholinergic drugs faced a 54% higher risk of developing dementia compared to those who avoided these medications entirely, more than half again the normal risk, solely attributable to what most consider a harmless sleep aid. Therefore, how can you safeguard your memory? The primary step involves rigorously avoiding anything containing diphenhydramine, especially if labeled PM, nighttime, or allergy relief. If you're reliant on diphenhydramine for allergies, Newer, non-sedating options like loratadine, Claritin are readily accessible. These antihistamines are engineered not to traverse the blood-brain barrier, making them dramatically safer for long-term use in seniors. Always remember, never cease any medication abruptly without medical guidance, but never assume over-the-counter automatically confers safety for your brain. Moving forward, we address a medication often marketed as harmless and gentle, yet one that systematically interferes with the very nutrients your brain desperately requires to stay sharp and healthy. Number 8 comprises proton pump inhibitors, PPIs, with specific examples including Prilosec and Nexium. These drugs are designed to drastically reduce stomach acid production and are routinely prescribed for heartburn, GERD, and acid reflux. Many seniors remain on these medications for years, even decades, because uncomfortable symptoms return immediately upon discontinuation. However, what is rarely discussed is how PPIs systematically impede the absorption of vitamin B12, a crucial nutrient for protecting brain tissue, supporting memory function, focus, and mood stability. A groundbreaking 2016 study published in JAMA Neurology examined over 73,000 individuals aged 75 and older, revealing that regular PPI users experienced a 44% increased risk of developing dementia compared to non-users. By aggressively suppressing stomach acid, PPIs impair absorption of B12, magnesium, and calcium, essential minerals for neural transmission and proper brain cell signaling. Without adequate levels, neurons struggle to fire efficiently, leading to misfiring, confusion, and memory lapses strikingly similar to early Alzheimer's disease. The problem extends deeper than nutrient depletion. PPIs have also been corroborated to elevate amyloid beta plaques within the brain, toxic protein aggregates disrupting normal brain function, and considered core drivers of Alzheimer's progression. The good news is that safer alternatives are readily available. If you're using a PPI daily, discuss with your physician slowly tapering off with the assistance of H2 blockers, such as famotidine, Pepcid. While not flawless, H2 blockers are significantly less likely to interfere with cognitive function. Additionally, chewing deglycyrrhiznated licorice, DGL, a natural compound, can provide symptom relief without inducing cognitive harm. Next on our list is a medication frequently prescribed for bladder control issues, yet one that harbors the potential to wreak havoc on both your short-term memory and emotional equilibrium. Number 7 is dedicated to bladder control medications, with specific emphasis on oxybutynin, Ditropan. Oxybutynin is prescribed to seniors grappling with urinary incontinence or overactive bladder problems, appearing as a practical solution. However, this medication operates by blocking acetylcholine, the precise critical brain chemical whose function is also disrupted by medications like Benadryl. Crucially, oxybutynin crosses the blood-brain barrier with remarkable ease, directly impacting sensitive memory regions within your hippocampus, making it particularly perilous for seniors, especially with prolonged use. A comprehensive 2019 study published in the British Medical Journal revealed that individuals over 65 who consistently took strong anticholinergic medications like oxybutynin for more than 1 full year exhibited a 49% higher risk of developing dementia, nearly 1 in every 2 users. What's even more concerning is that the vast majority of seniors are never adequately warned about these serious cognitive side effects. They're simply advised the medication will control their bladder, not that it may be accelerating mental decline with every dose. The insidious cognitive harm is frequently misattributed to normal aging. Patients commonly describe feeling mentally foggy, forgetting appointments, misplacing items, or struggling to follow conversations. Disturbingly, this is rarely connected back to the causative medication until significant damage has occurred. So, if you're currently taking oxybutynin and have observed any mental changes, understand these experiences are not in your head, and you don't have to remain on this drug. Fortunately, newer and safer medications are available, such as mirabegron, Myrbetriq. This innovative medication functions through a different physiological mechanism and has demonstrated less significant impact on memory function. These newer agents do not block acetylcholine at all and are generally considered safer options for older adults. Proceeding, we arrive at number 6. Statins. Statins rank among the most widely prescribed drugs globally, particularly for people over 60, intended to lower cholesterol levels and mitigate risk of heart attacks and strokes. Simvastatin, Zocor, and atorvastatin, Lipitor, are the two most commonly prescribed versions. However, here is precisely where a serious problem begins. Cholesterol is not solely a cardiovascular health concern. It is an absolute necessity for optimal brain function. Your brain is composed of nearly 60% fat, and cholesterol plays a critical, irreplaceable role in creating and maintaining the myelin sheath, the protective coating enabling nerve signals to travel smoothly and efficiently throughout your brain. Consequently, when you aggressively lower cholesterol with potent medications, you may simultaneously be effectively starving your brain of the precise elements it fundamentally requires to function with clarity. A concerning 2023 study published in Frontiers in Aging Neuroscience revealed that seniors over 70 who had been consistently taking statins for more than 3 consecutive years exhibited a 26% higher risk of developing mild cognitive impairment. High-dose statin users displayed even more pronounced declines. What's more alarming is that a significant number of patients reported sudden memory loss, describing frightening moments where they found themselves unable to recall familiar names, recent conversations, or even established driving routes. It is vital to comprehend that not all statins affect the brain equally. Certain medications within this class, such as pravastatin and rosuvastatin, do not traverse the blood-brain barrier with the same ease and are generally considered less risky for cognitive side effects. If you've been on a statin for years and begun to perceive persistent mental fog, increasing forgetfulness, or growing confusion, it might be the opportune moment to initiate a serious conversation with your doctor regarding either a potential dose reduction or a thorough exploration of alternative cholesterol management strategies. Do not defer this discussion until damage becomes irreversible. Earlier decisive action improves prospects of protecting your mind for years to come. Our journey brings us to number 5, benzodiazepines. This class of drugs, including lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, represent some of the most widely dispensed medications for anxiety disorders and sleep problems. They enhance GABA, your brain's natural calming chemical, reducing overstimulation. Initially, these medications appear as lifesavers, quieting racing thoughts, easing panic attacks, and aiding sleep. However, with time, they transform into a trap. A 2022 study published in the British Medical Journal followed over 8,000 seniors for 6 years, discovering that those who used benzodiazepines for more than 3 months faced a 51% increased risk of developing Alzheimer's disease. This risk escalated further for longer-acting benzodiazepines like diazepam, which persist longer and accumulate in fatty tissues, including brain tissue. What unfolds physiologically is a distinct form of chemical sedation that progressively decelerates neural activity across your entire brain. This means your brain gradually ceases to learn new information as rapidly as it should, becoming less flexible, less efficient, and increasingly susceptible to confusion, memory gaps, and emotional numbness. Seniors regularly consuming benzodiazepines frequently articulate feelings akin to moving through a perpetual fog, disconnected from reality, or just not feeling like themselves. The most insidious aspect surfaces during discontinuation. Withdrawal symptoms, encompassing severe anxiety, agitation, and debilitating insomnia, can be brutal, making the drug feel essential when it is, in fact, the primary source of the problem. To rectify this perilous situation, if you've been consistently taking a benzodiazepine for more than a few weeks, absolutely do not cease suddenly under any circumstances, as this can be dangerous, even life-threatening. Instead, collaborate closely with a knowledgeable doctor to gradually taper the dose down over weeks or even months. Safer therapeutic alternatives exist, such as buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy, CBT, specifically tailored for insomnia and anxiety, which can help restore calm and peace without precipitating progressive memory loss and cognitive decline. Continuing our discussion, we now turn our attention to number 4, amitriptyline, commonly sold as Elavil. Amitriptyline, a tricyclic antidepressant, is still commonly prescribed for chronic pain, persistent insomnia, and sometimes migraine prevention. At first glance, it might appear a versatile, multi-use miracle pill. However, beneath this utility, it is one of the most potent anticholinergic medications still in widespread circulation today, meaning it powerfully blocks acetylcholine, the indispensable chemical messenger that facilitates efficient communication between neurons, enables new memory formation, and is crucial for maintaining mental sharpness. Its inhibitory effect on acetylcholine is so pronounced that cognitive effects are not merely potential side effects, but essentially anticipated consequences with long-term usage. A massive 2015 study published in JAMA Internal Medicine examined over 3,400 adults aged 65 and older, discovering that those who took higher cumulative doses of anticholinergic medications like amitriptyline over a 10-year period faced a 54% greater chance of developing dementia, more than half again the normal risk. What's terrifying is the distressing fact that the vast majority of these patients were never informed this drug could actively harm their memory function. They were often prescribed it for sleep problems or nerve pain, then subtly began to observe troubling cognitive changes, short-term memory loss, persistent word-finding difficulties, and increasingly foggy concentration. It doesn't even necessitate a high dose to precipitate serious problems. Even low-dose amitriptyline taken nightly over several years can initiate a slow, insidious, invisible erosion of brain power that unfolds silently. The damage occurs without immediate, clear symptoms, merely a gradual decline superficially resembling normal aging, but in actuality, drug-induced cognitive impairment that could have been entirely prevented. Therefore, if you or a loved one is currently taking amitriptyline, engage in an immediate discussion with your physician about exploring safer therapeutic alternatives. For nerve pain, options like duloxetine or gabapentin may offer equivalent relief without the severe anticholinergic burden. For sleep, melatonin supplements or very low-dose doxepin with a milder anticholinergic profile can be utilized with less risk. For mood support, newer antidepressants like sertraline or escitalopram are generally considered safer for long-term brain health. Our investigative journey brings us to number 3, paroxetine. Widely known by its brand name Paxil, paroxetine is one of the most commonly prescribed selective serotonin reuptake inhibitors, SSRIs, for depression and anxiety disorders. At first glance, it presents as a modern, sophisticated antidepressant, believed gentler and safer than older generations. However, here lies the critical piece rarely disclosed. Paroxetine stands alone as the only SSRI medication possessing significant anticholinergic properties. This distinctive characteristic means it actively interferes with acetylcholine in your brain, rendering it drastically and fundamentally different from its SSRI counterparts like sertraline or escitalopram. In a substantial 2021 comprehensive review published in Frontiers in Psychiatry, researchers examined cognitive profiles of elderly patients taking various SSRI antidepressants, finding that paroxetine users consistently demonstrated measurable declines in short-term memory, verbal recall, and attention span within just the first 12 months of treatment. The study further revealed that seniors taking paroxetine were 30% more likely to exhibit early warning signs of cognitive impairment compared to those on other common antidepressants. The cruel irony is that paroxetine is often prescribed to stabilize mood and reduce anxiety, yet over time, it systematically undermines mental clarity and emotional regulation, tragically, defeating its intended purpose. The corrective action is straightforward and essential. Avoid paroxetine entirely in senior populations. The American Geriatric Society has officially placed paroxetine on its rigorous Beers criteria list, deeming it potentially inappropriate for older adults due to safety concerns. If you're currently taking it, discuss switching to safer alternatives like sertraline or escitalopram, which are significantly better tolerated and don't carry the same serious cognitive risks. Furthermore, supplementing with B vitamins, particularly B12 and B6, can provide natural mood support and may effectively reduce reliance on antidepressant medications. This brings us to number 2. A category especially alarming and disturbing because many seniors are unaware they are even taking an antipsychotic medication. Drugs such as quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Cyprea, were originally developed and approved for severe psychiatric conditions like schizophrenia and bipolar disorder. However, a concerning trend has emerged. Today, they are frequently prescribed off-label to elderly patients for common sleep problems, mild agitation, or behavioral changes associated with dementia itself. These are powerful drugs designed for severe psychiatric illness, yet now routinely administered in nursing homes and hospitals to seniors simply experiencing confusion, restlessness, or perceived as difficult to manage. The profound consequences are devastating. In 2022, a comprehensive study published in The Lancet Healthy Longevity followed over 25,000 older adults, finding that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within just 12 months, even without prior dementia history. Even worse, these dangerous drugs dramatically escalate the risk of stroke, sudden cardiac death, and severe sedation, directly precipitating falls, emergency hospitalization, or permanent institutionalization. The physiological mechanism is brutal and direct. These medications aggressively suppress dopamine, a crucial neurotransmitter linked to mood, motivation, executive function, and memory processing. When dopamine levels plummet dramatically, your brain becomes sluggish, slow, and unresponsive. This is precisely why seniors taking antipsychotics often appear dull, emotionally flat, or completely zombified. Their personalities seem to fade, and family members grieve for someone physically present but mentally and emotionally absent. Correcting this tragic and preventable situation begins with posing hard, direct questions. If you or a loved one is currently taking one of these powerful medications, ask the prescribing doctor why it was prescribed and whether it's truly medically necessary or just for convenience. In the vast majority of cases, behavioral symptoms can be effectively managed with non-drug interventions, structured daily routines, reduced environmental noise, addressing underlying pain, and improving lighting and sleep hygiene. When medications are absolutely necessary, using the lowest possible doses for the shortest periods can significantly mitigate harm. But more often than not, these drugs are employed out of convenience for staff, not genuine medical necessity for the patient. The real tragedy is that many families are never adequately informed about what these drugs truly do. They simply witness their loved one rapidly declining without comprehending the root cause is chemical, not natural aging. Finally, we arrive at the apex of our critical list, number 1, anticholinergic polypharmacy. This represents the hidden, pervasive danger almost nobody discusses, and it is, in all sincerity, one of the biggest, most profound contributors to drug-induced dementia in the elderly population. You may have been anticipating a single specific pharmaceutical agent to top this list. However, the most perilous medication situation leading to rapid dementia in seniors is not centered on one particular pill. Rather, it is the silent, creeping, exponentially cumulative effect of taking multiple medications that each possess anticholinergic properties, all at the exact same time. This is a profoundly dangerous pharmacological situation medical professionals refer to as anticholinergic polypharmacy. To illustrate this common scenario, consider a typical senior taking diphenhydramine every night for sleep, oxybutynin daily for bladder control, and amitriptyline for chronic pain. Each individual medication, taken in isolation, might induce only mild, barely perceptible memory problems, but when these anticholinergic drugs are combined, their effects compound exponentially, and the cumulative anticholinergic burden on your brain absolutely skyrockets to profoundly dangerous levels. This is far from merely a theoretical concern. It is a very real, scientifically validated threat. In a compelling 2022 analysis published in Age and Aging, researchers tracked over 280,000 older adults, finding that those with the highest anticholinergic burden exhibited a staggering 120% increased risk of developing dementia within a 10-year period, more than double the normal risk. And here lies the absolute worst part. The vast majority of these seniors had no idea they were even taking anticholinergic medications. Nobody had ever bothered to explain this critical information. When you aggressively block acetylcholine from multiple distinct angles simultaneously, your brain doesn't just slow down temporarily. It actively begins to decay and progressively deteriorate. Neurons physically wither from chronic underuse. Essential synapses shrink and disappear, and your brain enters a profound hypoactive state that, alarmingly, looks nearly identical to full-blown Alzheimer's disease on standard cognitive testing. Correcting this dangerous situation doesn't necessitate a miracle cure. It simply requires a thorough, comprehensive, and proactive medication review. Ask your doctor or a qualified pharmacist to carefully evaluate your complete list of medications, over-the-counter drugs, and even supplements for their individual and cumulative anticholinergic load. Sophisticated online tools and professional software programs can accurately calculate your cumulative anticholinergic burden score. Once problematic medications are identified, you can then work systematically to deprescribe, slowly and safely tapering off unnecessary medications, switching to safer alternatives whenever possible, and rebalancing your brain chemistry naturally. This, honestly, represents the most empowering and hopeful part of this entire discussion. Drug-induced dementia is very often genuinely reversible when caught early enough and when decisive action is taken. When the oppressive medication burden is lifted, many seniors dramatically regain mental clarity, experience a resurgence of physical energy, and show significant improvement in memory function, often within weeks or a few months of discontinuing problematic drugs. Your brain possesses remarkable resilience and an inherent ability to heal, but only if you provide it with a real, unburdened chance by diligently removing the very elements actively harming it. Polypharmacy, particularly anticholinergic polypharmacy, isn't just inherently dangerous and profoundly harmful. It is, crucially, completely preventable, and that indisputably makes it the #1 hidden medical threat to the precious minds of our entire aging population. Now, as we conclude this urgent conversation, I genuinely want to hear directly from each and every one of you. Which of these 9 medications are you currently taking right now? Have you personally observed any troubling brain fog, increasing forgetfulness, or noticeable personality changes since you began a new medication? Are you committed to initiating a crucial conversation with your doctor this week about conducting a thorough review of your complete medication list? Please share your invaluable experiences and honest opinions with us in the comments section below. We genuinely want to hear your story. Your personal narrative could profoundly assist another senior in avoiding this very same dangerous and avoidable situation. Thank you for your dedicated attention, and always remember, I am Dr. Michael Kent, and I am here with a steadfast commitment to help you stay sharp, healthy, and robustly strong for all the countless years that stretch ahead.